recent study published in eClinical Medicine, a group of researchers conducted a clinical trial on the effects of dapagliflozin on the urinary albumin to creatinine ratio, UACR, in patients with heart failure, HF, and type 2 diabetes mellitus, T2D. Sodium glucose cotransporter SGLT2 inhibitors, initially developed for T2D, have shown benefits in reducing death and other adverse outcomes in HF patients, with or without T2D. They have also improved renal outcomes in chronic kidney disease, CKD, even at reduced glomerular filtration rates, GFR, earlier like canagliflozin and renal events in diabetes with established nephropathy, clinical evaluation, credence, and dapagliflozin and prevention of adverse outcomes in CKD, Dapagliflozin, demonstrated SGLT2 inhibitors' effectiveness in reducing UACR, a key marker in CKD and HF. This multi-center, randomized, standard treatment-controlled trial was conducted at 18 medical facilities in Japan from May 2017 to March 2022. The study, sponsored by AstraZeneca and Ono pharmaceutical companies until August 2021, and statistical analyses were carried out by the Cardiovascular Center's Data Science Department. Eligible patients were those aged 20 to 85 years with HF and T2D, having specific criteria related to cardiac function, biomarker levels, and history of HF treatment, with an estimated GFR, eGFR, of at least greater than or equal 45 ml/min/1.73 m2. Exclusion criteria included insulin treatment, hypersensitivity to investigational drugs, serious liver diseases, and several other health conditions. The study did not set specific entry or exclusion criteria based on UACR value. In the present study, 144 patients were assigned to the dapagliflozin group and 141 to the control group. There was, however, no significant difference in demographic and baseline clinical characteristics between the two groups. Most of the cases included males at an average of about 72 years old. Many of them already have been suffering from hypertension and have been taking different cardiovascular drugs and anti-diabetic medications previously. From the 2-year follow-up, the primary outcome, the change in the UACR, did not differ significantly between the dapagliflozin arm and the control group. The median change in UACR between the two groups was minus 13.0 mg/GCR, having no statistical significance, 3.7 mg per GCR for dapagliflozin versus 6.9 mg per GCR control. Both groups also exhibited similar results in log-transformed values of UACR changes. Interpretation. Although dapagliflozin at a dose of 5 mg daily did not reduce urinary albumin excretion in patients with HF and T2D from that in the controls, our findings suggest that dapagliflozin decreased CV events and suppressed left ventricular remodeling. Funding: AstraZeneca KK, Ono Pharmaceutical Company, Ltd.